We promise not to be salesy on these webinars, yet this is the only slide that's going to be salesy. How about that? These are our sponsors for today, and to provide free content, just a quick plug for Devero. For those of you who don't know what Devero is one of the fastest growing EHR point of care scheduling billing solutions in the industry, serving home health, hospice, and other care at home providers. We do a unique forms-based EHR, so it makes it very easy for the clinicians to use. We pride ourselves on clinician satisfaction, ease of use, and flexibility for your organization. So if the documentation doesn't match your needs, you can actually bring in custom forms, state Medicaid waiver forms, for example, your own consent forms, agency-specific forms into the clinical documentation system. And we're now part of the NetSmart family, which means that we just became more robust in terms of offering more solutions, including interoperability to exchange data between healthcare settings. Our speaker today is Roger Shindell from Carosh Compliance Solutions, and Carosh is well known in the industry as the HIPAA experts, and they can help you evaluate your security and policy program, risk assessments, remediation plans, HIPAA policies and procedures, and help you prepare for the worst case scenario in terms of a data breach, and also training your workforce. So with that, I'd like to turn the platform over to our presenter, and Roger, you can take it away.
Well, thank you for that introduction, and thank you all for being here today. I am Roger Shindell, founder, president, and CEO of Carosh Compliance Solutions, and we're going to talk today about the road to compliance in terms of HIPAA for home care and hospice, and we'll actually point out some VNA agencies also. So today we're going to give you a brief who are we. We're going to talk about why HIPAA compliance should be on your radar in a different way than most people typically talk about it. We're going to talk about the basic components for a compliance plan to keep you on the right side of the regulatory agencies, how to assess your own compliance with the regulations, introduce you to some new threats as if there weren't enough. We have some new threats that are coming down the road that you need to be aware of, and then talk about how you can get more help. Now, as part of this presentation, we're actually, at the end, there's a quality survey, and for anybody who takes that survey, we are providing an hour's worth of HIPAA training that will pass regulatory scrutiny. I'm going to explain a little bit further down why most of it doesn't, and we're also going to provide you with a couple policies and procedures. Once you understand what training needs to look like, the policies and procedures will be very helpful. So fill out the survey, we'll have your email address, and we'll get those out to you. So a little bit about my company. We've been in business doing this for over 7 years. All of our professionals are certified by one of the major associations in the industry, HIMSS, IHIMA, ISC squared, ISACA, etc. And one of the things I'm going to talk about as we go forward is you really need to understand who is giving you HIPAA information. There's a lot of misinformation and bad information out there. Since 2012, all we've done is HIPAA. Prior to that, we were doing online learning around EHRs. But in 2012, we were asked to do some training around HIPAA and looked at the industry and looked at what was out there. And my having a background in IT, technology, auditing, and actually home care and other medical institutions, we transitioned into solely becoming a HIPAA consultancy. And we only work with medium to small-sized organizations. There's a lot of expensive consulting firms out there that will work with the 5,000 physician hospitals. That's not us. We target medium and small-sized organizations primarily because they have their own unique needs. Currently, we have 5 professionals and 4 support staff, and we have offices in Indiana, which is where our corporate is, in Illinois, in Georgia, and in Iowa. So we do have a national presence, primarily just east of the Mississippi, although Iowa is on the other side, and are continually expanding into different regions, but again, just working on HIPAA consultancy. So let's start on why HIPAA compliance should be on your radar. And these are all valid reasons that I have down here. And they're the ones that you hear over and over again. Civil liabilities, fines and penalties. But the big issues are identity theft and medical identity theft. Everybody, I'm sure, has heard of the Equifax breach, 147 million records potentially out there. Those are identity theft activities, which are actually easier to remediate than a medical identity theft, for the sole reason that while you can come up with a new financial record, your bank can give you new accounts, get new credit cards, etc., your medical record has to follow you throughout your life. So we believe that people should look at HIPAA, which actually is now a euphemism in many cases for PHI, Protected Health Information, and PII, Protected Individual Information, all have regulatory requirements both at the state and federal level. If you're complying under the HIPAA regulations, you'll be confident to be compliant on all the other regulatory agencies that you may bump up against. We'll talk about that a little bit later. And it's also just good business. If you think about what fines and penalties are under HIPAA, those amount to about 15% of the total cost of having a breach, and we'll talk about that a little bit more. So when you see fines and penalties in the 6 figures, think that the actual cost of the organization is somewhere around 5 times that. And again, it's just good ethical and professional standards to make sure that your patients, your clients' information is private, safe, and secure. So let's start by looking at some agencies who didn't pay attention. So the first one we're going to talk about is Pruitt Health Hospice in South Carolina. They had a breach that was a little over 1,400 records, and it was a theft of paper documents. Now, one of the things that everybody thinks about regarding HIPAA is no more than security on your IT infrastructure. And unfortunately, hacking breaches, while they involve the largest number of records, are a very small percentage of the actual breaches that occur. And you're going to see that in what I'm going to show you in the next few slides, that the vast majority of breaches are around theft, either of paper or some kind of electronic media. And you also notice over here on the right, the results, while this hasn't been adjudicated yet, and let me talk about that for a short minute or a couple of seconds, it typically takes about 2 to 3 years to get through an investigation, whether it be a breach. Audits go much faster, but a breach or a complaint are long-timed investigations by OCR. So the fact that these have not been adjudicated, fines haven't been assessed yet, should not be a reason to not be concerned about this, because you can have OCR, Office for Civil Rights, in your operation for multiple years trying to get through these breaches. But if you notice over here, the results include additional physical security and training. And one of the things that we're going to find with OCR, Office of Civil Rights, is their opinion is that virtually all breaches occur because of the lack of adequate training. So adequate training is going to come up over and over again. So here's another one. This was the Indian Territory Home and Hospice Agency, 4,500 breaches. This one actually was a cyber attack. It was a phishing email. So someone clicked on a malicious link in an email. They hadn't been trained on how to identify those links. and all of a sudden you have 4,500 records out there in the world being sold in the dark markets for a fair amount of money. Depending upon who you read, these medical records go for somewhere between $25 and $320, depending on how complete the record is. You also know that Social Security numbers are out there, and Social Security numbers will lead to other kinds of identity theft outside of just the medical record theft. So here's two more. Here's a Medicis in Hospice in Tennessee. Again, this one is interesting because medical records were found on the side of the highway. And the challenge and what happened was an employee who was tasked with destroying these records, shredding them, just threw them out. And this is the first time that's happened. In fact, the largest case of a breach until 2015 was a pharmacy in Indiana who had almost 1 million records that were supposed to be shredded, thrown in a dumpster by a subcontractor who was tasked with shredding those records. So this is something that can happen and does happen. Next one, this is actually a Medicis going overboard and doing the right thing. They had 140 missing encrypted drives. The reason we push on encryption is that if you encrypt your media, you actually have a safe harbor exemption from a breach, which means that it doesn't need to be reported. You're not going to be liable for fines or penalties, which is why you hear over and over again that you should be encrypting all areas where you have protected health information or personal, private personal information residing. So they've gone ahead and done things that they don't need to do because they're encrypted, but are being a good neighbor on the privacy side, the just-in-case scenario. Okay, here's another one, Hospice of the Chesapeake. Here's one where an employee emailed spreadsheets with PHI to a personal email account, and the spreadsheets may be viewed by a third party. This next one is one of my favorite ones. We're going to take a little bit of time on it. This was Clearwater, Florida. This is only 270 records. Notice that over at the left. And what happened was an ex-husband of an employee found records left in the car, found records under the bed and in the kitchen, and he wasn't authorized to have access to those records. It was his ex-wife who had the authorization. At the time, employees were allowed to take PHI from the premises and were ordered to keep copies of documents in their car in the event that something happened. Well, what happened in this case was they were fined almost $240,000. That was $240,000 for 270 records. So one of the things you need to understand is when fines and penalties are assessed, they're not assessed based upon the number of records that have been inappropriately disclosed, but rather it's based on how well you are complying with the regulations. And in this case, the company had no policies to monitor paper records taken out of the agency. And so OCR actually said, and this is true, that you need to, including health providers, ensure that workforce members take PHI off-site. They have adequate policies and procedures that provide for the reasonable and appropriate safeguard of PHI, whether in paper or electric form. So in this case, it was a $240,000 fine for not having adequate policies and procedures in place. And here's another couple ones. So here's one in Causewell, Georgia. This is 3 laptops were stolen during a break-in against the theft again, but they were unencrypted. 5,300 plus records were on the device that was stolen. There are also paper and billing records which may have been reviewed but were not taken. And then we have Hope Hospice in Texas. This is an email containing PHI was sent from a work email address to a home email address by a workforce member. So we actually have a client that something similar happened to. It was a dentist, and what was happening was the office staff, 2 of them, were emailing patient records to themselves at home because they were joining with 2 other dentists in the practice to open an independent dental practice, and were actually accessing the records and acquiring them for marketing purposes of their own practice. So as much as we want to and should be trusting our employees, we need to have significant controls in place to minimize the ability of records to leave the office. And then here's the last one. Well, I have another page left on this page. Again, a notebook was stolen during a robbery. This is a concern that they didn't know how many records were on the notebook. You should always understand how many records you have in different locations because it's going to be important when you have to remediate a breach that you'll have. And the breaches will either be self-reported, someone else reports them, or someone files a complaint. So you need to have your ducks in a row and have a good handle on all your records, whether they be electronic or paper. So this is an example I want you to leave this part of the presentation with. This is 2 organizations. One's a hospice. This is actually the first hospice to be fined for a breach of less than 500 records. And then HCI Homecare, a visiting nurse service in Iowa. So one was 441 records. The other was 1,700 records. First one was an unencrypted laptop was stolen, and the second one was paper records were stolen out of a car. So similar kinds of circumstances, but the result was vastly different. For Hospice in Northern Idaho, they ended up with a $50,000 fine. HHS, who oversees OCR, so Human Health Services oversees Office for Civil Rights, found that Hospice of Northern Idaho had not done a risk assessment, was not protecting their PHI. They didn't have policies and procedures in place to address mobile devices. On the other hand, HCI Homecare and Visiting Nurse Services, when they were investigated, walked away with no fines and no penalties for essentially the same kind of breach. And the reason for that is they could document all the things they had done to be compliant with the regulations under HIPAA and high tech. OCR, Office for Civil Rights, understands that you can't keep all breaches from occurring, and you can't, and you need to remediate any breaches that occur, that do occur in a timely manner. But if you can demonstrate that you have done everything you can to keep the information safe and secure and not inappropriately accessed, you have a good possibility of walking away without fines or penalties. So word of the wise, it's an insurance policy that's well worth any cost to make sure that you are compliant, because you can be looking at a $50,000 fine, you can be looking at a $500,000 fine. Recently, the fine levels have gone up because the regulatory agencies have just decided enough time has gone by. People have not been taking HIPAA seriously, and so they are ramping up their enforcement activities. So how do you prepare and protect yourself? And that's really what HIPAA is about. So these are the basic components to a HIPAA compliance program they're going to use. And again, I'm using HIPAA as a euphemism for all the regulatory agencies you're going to run into. If you're compliant with the HIPAA requirements, you will be compliant with anything from the SEC, from the FCC, any of the state laws, other regulations at the federal level. They all look to HIPAA as being the gold standard for compliance. So you need to start out with conducting a risk assessment. The one on the security side is actually required and is part of the regulations. The one on the privacy side isn't explicitly stated in the regulations, but it is a good format to use to make sure that you are doing what is required, which is to have safeguards to address any of the vulnerabilities outlined in the regulations. So once you've done your risk assessments, you need to conduct a remediation plan. So conducting the assessment percolates up any areas of vulnerability. The remediation plan is exactly what it says. It's a time-sensitive plan to remediate those vulnerabilities, and you want to be able to demonstrate that you are making meaningful progress through that plan when you have an investigation by a regulatory agency, because if you're not making meaningful progress, they're going to begin to ding you on your violations. Once you have the remediation plan, you want to correct the deficiencies. Then, per the regulations, you need to implement an audit and management plan, so an internal audit of your privacy and security program and how you're going to manage the plan. And throughout all of this, you need to do training and a specific kind of training. So these 5 areas we're going to talk about through the rest of this presentation. So, first question, have you conducted a security risk assessment? So the risk assessment needs to follow NIST 800-30. NIST is National Institute of Standards and Technology, and although the regulations don't explicitly state this protocol, much of the guidance that comes out of Office for Civil Rights talks about NIST 800-30, and anybody else in the industry that you're working with, any of the associations, may call it something different, but they're all following the NIST 800-30 protocol. I apologize, I keep getting bumped out of my presentation. So you need to follow the NIST. You need to generate a remediation plan. And these assessments and remediation plans need to be updated regularly. So typically you're going to want to update them on an annual basis. You're going to want to update them whenever you have a security incident to try and figure out why you had the incident occurred, that your safeguards were not appropriate or sufficient to keep the incident from occurring, and you want to update that portion of the risk assessment remediation plan whenever you make a change to your operations policies or your IT infrastructure or your physical security framework. So this is an example of what you may see if you're doing a security risk assessment, and I point this out only because it looks like you're going to answer a series of questions, yes or no. This actually comes from the software that we've developed, HIPAA Suite, and so what we do is we will ask about 6 questions around the specific vulnerability we're looking at, and so behind this is an algorithm that you don't see, that most people want to hide from you, only so you don't get caught in how do I do this. And having done dozens upon dozens upon dozens upon dozens of these, we know how to assess the probabilities that need to be in that algorithm behind that checklist. So essentially for every one of the questions that you would see, which is a threat, and for every threat, we would have, or you will have to assess the likelihood or the probability of that threat coming to pass, and then the size of the impact that threat, if it comes to pass, has on you and has on the individuals whose information has been breached. So per the regulations, you need to be able to assign these probabilities that can change over time. And then what you want to do, what happens is we take these quantitative numbers and we turn them into qualitative risk scores, which are required to have, and they go into a remediation plan, which again is one of the regulatory requirements. So the remediation plan should have a risk score, so we take those quantitative numbers and turn them into qualitative measures, typically high, medium, and low risk, so that we can remediate the high risk ones soonest, because remember, those are the ones that are going to have the most likely probability of occurring, and they're going to have the highest impact. So you have that risk score for every threat. It's identified in the regulations. You need to have an action plan on how you're going to remediate that, and in the regulations, there will be action plans. Some are required, some are addressable. Addressable means that you have an alternative way to meet the same objective, but you still need to do it. You also have to have someone who approves that this vulnerability has been remediated. And as I talked about earlier, this is time sensitive, so you're going to have a target date of when you're going to remediate this. And again, it's just a target, and it's there because you need to be able to show meaningful progress through the plan when the regulatory agencies are doing an investigation. So then, have you corrected your deficiencies? And so typically there are deficiencies that will be administrative policies and procedures, and others will be technical safeguards you put in place. But those will still be delineated out in a policy and procedure. So this is one of the policies we're going to send you, and what it needs to have in it is it needs to have a purpose, which is fairly typical for a policy and a procedure. Who's responsible for the implementation? And within HIPAA, it's typically the Chief Privacy Officer or the Chief Security Officer, both of which you need to identify in your organization. What's the scope of the policy? What's the actual policy itself, which are the steps you take to make sure that you are addressing everything within the scope. And then the procedure is the step-by-step. The policy is the overview of what you're going to do. So the procedure is step-by-step through the policies. Then you want to, this is not required by regulation, but you want to have all your policies and procedures and safeguards categorized by the regulation in the HIPAA or HITECH Acts. Reason for that is when the regulatory agency comes in to do an investigation, they're not going to say, send me all your policies and procedures. They're going to say, send me the policy around CFR 164.306.d.1, or send me your policy around encryption. And you don't have a long time available to get your document request in place for a breach investigation. It's 20 business days. And 20 business days may seem like a lot, but not if you have to run around looking for all this information and reconcile it to the standard and the regulations. So you want to make sure that everything you do is indexed by the regulation number. And then the distribution, the policy may be for the organization as a whole. It may be for different departments or different facilities. So you want to make sure you understand who's going to be using this policy. And you want a version history. And this is important because under the HIPAA regulations, OCR can ask you for up to 6 years worth of data on anything regarding HIPAA. And that means they can ask for every version of the specific policy you're presenting to them. So you want to make sure that you have each version archived, available, and ready in the event you need to, or in the inevitable event when you are going to need to produce it. And so you have a prepared by, a reviewed by, and when the content was changed. So those are the core items you should have in every one of your policies within your privacy and security program. So the next item we talked about was, do you have an internal auditing and monitoring program for privacy and security? Again, this is in the regulations. And so what do we mean? We mean that we have a model that says what, how, and when. What are we going to monitor, which is goals and targets. How are we going to do the monitoring is through metrics and methods. And when is the frequency. So you need to put all your policies on a cycle where you're going to do the internal audit and monitoring. So here's a couple of examples. So if we're going to audit policies, the what is, we want to make sure that the policies as written are actually being complied with as written. One of the things many organizations will do is buy templated policies, put their name on them, throw it in a manual, and say we're good to go. And unfortunately, that won't comply with the regulatory agency requirements, and you won't successfully pass regulatory scrutiny. So it's important that you actually customize your policies and procedures and safeguards, and the written document reflects how you actually operate. So how do we do this? We typically do chart audits, observations, and surveys. And when it's variable, you put all the policies on a cycle. With our clients, we try and get them on a 3-year cycle. Some policies don't need to be reviewed very often. Others should be reviewed at least annually, if not more so. So as another example, training. So what are we going to audit? That all workforce members were trained. How are we going to do that? We reconcile training reports against workforce member lists. And when are we going to do that? Again, the discretion is up to you. I would say at least annually, probably quarterly, monthly for most organizations is more than you need to worry about. Then the last one is an example of safeguards. So these are technical safeguards that have been put in place. So what are we going to audit and monitor? How those safeguards were implemented? Do they reflect what we said we were going to do? How do we do it? We actually do a walkthrough where we'll watch someone work with the implemented safeguard. Maybe it's the review of a log file. So we'll go through the whole process of watching how they do their log file reviews. Maybe it'll be for identity authentication or offboarding employees. So any kind of the safeguards we put in place, we typically do a walkthrough so we can attest to the fact that you are complying with what you said you have in your policies. And again, when to do these, quarterly, annually, we put them on, and you should put them on a cycle that you follow and can document and show to the regulatory agencies when needed. Okay, next is, have you conducted due diligence on your business associates, which is a relatively new one. Prior to 2013, before the omnibus rule, if you had a business associate agreement in place with your business associates and it was an adequate agreement, you had a safe harbor exemption from any breaches that they caused of your data. Since 2012, you need to now reasonably anticipate, identify, and protect against threats to the security or integrity of your information, not only with you operating it, but also your business associates working with your information. And same thing for disclosures. So what people don't seem to understand is, and this is right out of the regulation, pretty much the actual verbiage, but you're required to protect against these vulnerabilities. And if you discover a pattern of activity or practice that your business associate is in violation of the BA agreement, the BA agreement is nothing more than an agreement that says they're going to comply with all the HIPAA regulations. So basically, if they're not complying with the HIPAA regulations and they fail to take reasonable steps to cure that, and if they're unsuccessful, you're actually required to terminate your contract with that business associate if feasible. If feasible means you need to be able to document and justify that there is no alternative source for the service that your business associate is providing to be able to use that that exception from terminating your contract. So for that reason, it's important to identify your business associates and make sure they're complying with the regulation under HIPAA. We have something we use called HIPAA Diagnostic that we developed. It looks at all those items that are typical, sort of the major red flags that gives you a good sense of whether someone is complying with the regulations or not. And so it looks at do they have policies and procedures? Are they up to date and effective? Do they reflect how they actually operate? Do they have training that will pass regulatory scrutiny? And I'll talk about that in a moment. Have they done the security risk assessment? Do they have an auditing and monitoring program in place? And have they done due diligence on their subcontractors? If they're not doing these things at a high level, then you're going to have a pretty good sense that they're not compliant with the regulations. If they are doing all these things and they can justify and document that in fact they're doing them, you're going to have a pretty good sense of that they're complying with the regulations and that you're safe in opening up your protected health information to them. There's a balance here between how much of an investigation can be done versus how confident you're going to be that they're in compliance. If you look at these 5 different items, you'll be able to get a good handle on their compliance. Okay? So training requirements, and this is something that always come up, and it's sort of a good news, bad news thing. Most people are doing some kind of HIPAA training, typically on an annual basis, and it's generalized training about this is what HIPAA is, on and on. But this is a restatement of the actual regulation in that workforce members need to be trained on your specific policies and procedures relevant to do their job, which means that getting generalized HIPAA training about this is what HIPAA is, this is what came in, it's about different kinds of safeguards, administrative, physical, and technical. You really need to be training on your own policies and procedures in the event or when it occurs that you are going to be investigated by a regulatory agency. It's one of the first things they're going to look at because the vast majority of organizations don't do adequate training. And if you look at the resolution agreements that OCR writes up with people who have had breaches and they post them on their website, you can Google resolution agreements, OCR, they'll come up, and in virtually every case, they cite the organization for inadequate training. As I said earlier in the presentation, they believe that virtually all breaches occur because of inadequate training. Okay, so let's talk about the new future of what we need to look at. So everybody now has heard, I'm sure, about ransomware attacks, and here's a series that happened during this year. And what I wanted to point out was it's not a problem just for large organizations, but also for small organizations. Okay, but there's an additional threat out there, and it actually came to the fore with the WannaCry ransomware attack that just occurred, and that is medical devices. All the wearables, all the devices, all the telemedicine where a device is involved that is making your life easier and attempting to keep patients from readmission, all have vulnerabilities to them. And the vulnerability comes, there's a whole structural reason why they're there, but that doesn't really help you. So basically, a vulnerability in a device can allow unauthorized users to remotely access and control the device or to find a portal into your system, particularly if you're using wireless devices. So we call it metajacking, and these hackers are professionals. They're organized criminals. They may have state sponsorship from other malicious states, bad actors, and they target these medical devices because most of them don't have sufficient cyber protective measures. Something like 85% of all remote devices never had their password changed from the factory default settings. So these malicious actors actually know how to get into these devices because the settings aren't being changed. These are devices, a series of devices that have been attacked already. So diagnostic equipment, therapeutic equipment, infusion pumps, lasers, LASIK machines, life support equipment, heart-lung machines, those kinds of things. If anybody is a fan of House of Cards on Netflix in the second season, one of the protagonists killed off the vice president by hacking into his pacemaker and giving him a heart attack. So that used to be Hollywood, and actually it's actually occurring now. So this is the Veteran Affairs tracked 173 devices that were infected since January 2009. In 2006, TrapX Security, a large security firm that works in this space, reported on 3 of their clients who had been infected. blood gas analyzer, a radiology practice, and our X-ray system and archives. And then most recently, the WannaCry ransomware attack this last May, Bayer's MedRad device was found to have been infected. Siemens Healththinker Technologies is reviewing their full portfolio of devices to make sure they're not at risk and trying to plug those risks. And Becton Dixon and Company is looking through 45 of their devices and systems. So how can you protect yourself? You need to make sure that you have a robust privacy and security program in place, and that someone who's put it in place really understands and knows what they're doing, understands the nuance of the regulations and how you operate. You want to make sure that all your partners in the care continuum have a robust privacy and security program. You know, the amount of data that gets shared and the data that gets shared through shared EHRs is growing, and now with mobile devices, it's growing even more. And so we really need to be concerned that everybody in the care continuum is doing everything they can to comply with the regulations. And your device vendors, who are probably going to be business associates, you make sure that they're in compliance and understand the challenges they have to making their updated devices compliant. So how do you get more help? So we think that this is a very difficult thing for organizations unless they're sufficient size to do on their own. So our belief is you need to find yourself a trusted advisor who understands HIPAA. That's what they live and breathe. It's not an add-on to them because it's very convoluted and complicated. And what they'll help you do is evaluate your security and privacy program. They will help you complete your required security risk assessments, generate the remediation plan, help you work on customized policies and procedures, prepare for a breach or an audit or an investigation through a complaint. And actually, breaches and complaints are the most likely way that you're going to end up being addressed by a regulatory agency. And then they're going to help you train your workforce. So we'll take questions now, and while we're doing the questions, there's a link up here. It's a quality survey on this webinar. We'd ask you that you fill it out. It'll take you about 2 minutes. Anybody who fills out the survey, we will then send you the certificate of completion for this training, and you'll receive the policies and procedures that were addressed during this training. So there's one more slide down here, and I will now turn it over to you, Stephanie. I want to thank everybody for listening. I know I rushed through this, but we didn't have a whole lot of time to go over a lot of information.
Thanks, Roger. We do have a few questions, and the first question is, are compliance plans required? Yes.
From the regulatory agency's perspective, if you do not have it in writing, if you do not have a plan, you're not compliant, they're not going to come in and say, okay, show me what you're doing. They are going to ask you to demonstrate that you've documented everything you're going to do, that you have a plan in place, and that you're following the plan, that you're reviewing it periodically and updating it as necessary. So absolutely that plan is required. Even if you turn out to be a sole practitioner. We have as a client, a sole practitioner wound care nurse who gets contracted out to home care agencies. And she went through the process of being compliant, and there's some very cost-effective ways to get there. But you do need to get there and have a robust compliance plan.
Thank you. And Roger, if you wouldn't mind showing the previous screen, I need to type in that link for folks that want to take the survey. So for those of you who have asked that question, I'll type that into chat for everybody. The next question, how do you have HIPAA compliant communication with patients or medical providers via text messages?
Well, with medical providers, it's a little bit more difficult, so let me address with the patient first. The patient has the right to ask for alternative means of communication. So when you are registering to provide services and they have an agreement for services or whatever document you use, you can add a paragraph or a sentence asking if they want alternative means of communication, and that would be email or texting. And you need to have a little paragraph that explains the risks to them. But for a patient, it's as easy as getting them to sign off on that, then you don't need to worry about using encrypted texting. For people in the care team or the care continuum, it's a little bit more difficult. There are really only two ways to address it then. One is to send information without an identifier. So in a manner where someone could not be identified related to the information you're sending, but is sufficient for the provider to know who you're talking about. It can't be a number that can be tracked back, but you can come up with something to use. But the easier way to do it, quite honestly, is to use an encrypted text messaging system. There are very good ones out there. Some of them are very cheap or at no cost. But there really is no way to get around with a provider text messaging unless you make it de-identified or you use some kind of encrypted service.
Thanks, Roger. And for those of you still on the webinar, I did post the link to that survey in the chat area. So take a look at your GoToWebinar toolbar, and you should see that link there. We have a few minutes left, and there are a couple of other questions. You listed a lot of breaches as examples, but many did not have fines associated with them. Should this really be a concern?
Well, the answer to that is yes. When I went looking for the breaches, I went and looked at the most recent ones we could find. It takes a number of years to go through the process of a breach being identified and the investigation occurring and the remediation happening and it being published. So many of those didn't have fines because they haven't finished the process. If I'd gone out and just looked for different organizations that weren't home care and hospice, we would have come up with many, many more large fines. I would not take to heart the fact that these folks haven't gotten through the remediation or through the investigation process yet and had fines levied and feel safe and secure about that. And then also remember, as I said earlier, the fines amount to only about 15% of the actual cost of the organization for a breach that they have. So I would in no way take encouragement from the fact that those breaches have not been completely resolved yet and fines elevated. Fines are getting larger, they're getting more frequent. And again, just as a reminder, they're not based on the number of records, but rather your compliance with the regulations.
Thanks. And just looking at the time, it looks like we might have time for one more question. Can you name some examples of reliable text messaging encryption services?
Yeah, we don't do that. I apologize, but there's just so many, they change. We just make it a policy not to recommend different kinds of services. We don't even do it for our clients, except in unusual circumstances. I would say if you Google encrypted text messaging, you'll get a plethora of them coming up. And one thing I will say, if you use Skype as an example, Skype encrypts everything, and you can actually use Skype as a text messaging service, but it's kind of difficult to get people to use. Most people are looking for a simple text messaging. So I apologize, but I'm going to have to acquiesce from giving you examples. Just our policy.
And one last question. We conduct our HIPAA training annually. Is that enough?
Well, given that HIPAA is, or training is the number one thing the regulatory agencies look at in terms of your compliance, my personal opinion is no. The more shorter trainings you do, the more you're going to keep awareness of the need for privacy and security in everybody's mind. The idea behind the training is not to check a box, but to build a culture of compliance. And so what we advise is at least quarterly, and more frequently if your policy is to hold staff meetings. If you bring the staff together and you can do a 5-minute training at every staff meeting, and you do them once a month or once a week, and by the end of the year, you've gotten through much of the training you need to do. So I would like to push people off the idea that annual training is going to be sufficient and is going to help create that culture of compliance. And by the way, you're also obligated under the regulations to do additional security awareness. I'll put trainings in quotes, but they can be emails going out to folks telling them, to remember not to share passwords, but periodic reminders about security is not part of the training, and both those items are required under the regulations.
Thanks, Roger. And we're out of time, so if for some reason we did not get to your question, we will follow up with you on an individual basis. And we'd like to thank you again for taking time to join us today, and enjoy the rest of your day. Thank you.